Did you know that your body can warn you about a potential stroke days or even weeks in advance? While many people believe that a stroke occurs suddenly and without warning, the truth is that the body often sends subtle signals that can save your life, if you know how to recognize them. In this video, you'll learn about the warning signs that could indicate an impending stroke and why it's crucial to pay attention to them. We'll also explore how you can reduce your risk of stroke by up to 97%. Additionally, we'll take a closer look at the mechanisms behind stroke development, helping you better understand what happens in the body and how you can protect your health. A stroke is a sudden disruption of blood flow to the brain, leading to the death of brain cells, an event that can have serious consequences for both your health and your life. In as many as 80% of cases, we're dealing with what's known as an ischemic stroke. This occurs when a blood vessel in the brain becomes blocked by a blood clot. Such a clot can form in the carotid artery or travel from the heart through the bloodstream. What causes an ischemic stroke? The most common culprit is atherosclerosis, a condition that develops as a result of our daily habits. An unhealthy diet, lack of physical activity, and smoking are just a few of the factors that contribute to its progression. But that's not all. Atherosclerosis often goes hand in hand with uncontrolled high blood pressure, diabetes, and elevated cholesterol levels. Together, these factors significantly increase the risk of blood vessel blockages and, ultimately, a stroke. The other type of stroke is a hemorrhagic stroke, which accounts for about 20% of all cases. This occurs when a blood vessel ruptures, causing blood to leak into the brain tissue. Such bleeding leads to increased intracranial pressure and compression of the brain, which can result in severe consequences. Hemorrhagic strokes are most often caused by uncontrolled high blood pressure, brain aneurysms, or head injuries. Now that we understand what a stroke is and what causes it, it's time to move on to the most important part of this episode: the warning signs of a stroke. I want to emphasize once again that the symptoms I'm about to discuss may, though they don't always, appear days or even weeks before the actual stroke occurs. That's why recognizing these signs early and seeking medical attention can significantly increase your chances of preventing a stroke and protecting your health. Now let's address the key question: what warning signs might alert us to the risk of a stroke? The first warning sign is the so-called sentinel headache. This is a headache that hasn't occurred before. It may be extremely intense or completely different from any headache you've experienced in the past. Importantly, this type of headache often appears about 7 days before a stroke. In a study involving 550 people who experienced an ischemic stroke, as many as 15% reported a new, unusual headache that persisted throughout the week leading up to the stroke. Similar results were found in an earlier study conducted with 120 stroke patients. In this case, 18% of participants reported experiencing a sentinel headache. Based on the patient's descriptions, the headache warning of a stroke often resembles a migraine, but can also take the form of a tension headache or what's known as a thunderclap headache. What other symptoms might warn of a stroke? Another key warning sign includes difficulties with concentration, feelings of confusion, and mental distraction. These symptoms may stem from small vessel disease, hardening and damage to the tiny blood vessels that supply oxygen and blood to the brain. What should you know about small vessel disease in the brain? It's estimated that this condition is responsible for up to 30% of ischemic strokes. The previously mentioned concentration issues, such as frequently going off topic or losing your train of thought during a conversation, can also be a symptom of what's known as a mini-stroke. This is crucial because a mini-stroke, or transient ischemic attack, is a serious warning sign that should never be ignored. Why is a mini-stroke such an important warning sign? A mini-stroke, or transient ischemic attack, occurs due to a temporary blockage, lasting just a few minutes, or a significant reduction in blood flow within the vessels that supply oxygen and nutrients to the brain. This is critically important because such episodes can serve as a precursor to a full-blown stroke if timely action isn't taken. How can you recognize a mini-stroke? Dear viewers, a transient ischemic attack, or mini-stroke, presents symptoms similar to those of a full-blown stroke, but these symptoms typically resolve within a few minutes, several minutes, or at most, within 24 hours. The symptoms appear suddenly and may include Numbness in the legs, arms, or face, usually on one side of the body. Difficulty speaking, finding the right words, or reading. Problems with counting. Vision disturbances in one or both eyes. Severe headache or dizziness. Trouble maintaining balance. And the previously mentioned issues with concentration. It's important to remember that the symptoms of a mini stroke can vary. The specific symptoms depend on which part of the brain is affected by the lack of blood flow. Some people may experience only one symptom, while others may have several at the same time. Why should these symptoms never be ignored? Even if the symptoms last only a short time and completely disappear, they should never be taken lightly. Warning signs of a stroke, including mini-stroke symptoms, are serious red flags indicating impaired blood flow in the brain's vessels. Every such symptom should be promptly evaluated by a doctor. It is estimated that up to 1/3 of patients who experience a mini-stroke will go on to have a full-blown ischemic stroke in the future. This is why it's so important to stay vigilant and act quickly. Timely treatment, such as the use of antiplatelet or anticoagulant medications, along with adopting a healthier lifestyle, is an effective way to significantly reduce this risk. According to current scientific evidence, the risk of a stroke within 90 days for patients hospitalized after a mini-stroke is less than 3%. In other words, we can reduce the likelihood of a full-blown stroke by 97%. This makes it a life-saving intervention. This is why stroke symptoms should never be ignored. Even if they last only a few minutes, it's crucial to seek medical attention as soon as possible. In emergency situations, when symptoms are pronounced or cause concern, don't hesitate. Call an ambulance immediately. To wrap things up, I want to mention the FAST test, a simple and effective way to quickly recognize the signs of a stroke. Acting fast can save a life. F for face. Ask the person to smile. If one side of their face droops, it could be a sign of a stroke. A for arms. Ask them to raise both arms. If one arm drifts downward or feels weak, that's another warning sign. S for speech. Ask them to repeat a simple sentence. If their speech is slurred, unclear, or they can't speak at all, it could mean they're having a stroke. T for time. Call 911 immediately if you notice any of these symptoms. Don't wait. Every minute counts when it comes to stroke treatment. Recognizing these signs and acting fast can make all the difference. And even if the symptoms subside while, for example, waiting for or calling an ambulance, it doesn't matter. This likely indicates a mini-stroke, which, as we now know, also requires medical attention since it can signal a full-blown stroke in the near future. Let me remind you once again. If we act during a mini-stroke and undergo treatment with antiplatelet or anticoagulant medications, we can reduce the risk of a full-blown stroke by 97%. If you'd like to learn more about how to prevent a stroke, let me know in the comments. I'd be happy to create another episode on this topic. That's all for today. Thank you for being here and taking the time to explore this important subject with me. If you found this episode valuable and think it could help others, feel free to share it on your social media. Don't forget to leave a thumbs up, write a comment, and subscribe to my channel if you haven't already. This way, you won't miss future episodes, and I'll be able to create even more helpful content for you. As always, I hope to see you in the next episode. Take care and stay healthy.